Welcome to today's program, and thank you for joining us. I'm C. Virginia Fields, former Manhattan Borough President, and currently the President and CEO of the National Black Leadership Commission on AIDS, Incorporated. The mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower Black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. Tuesday, July 25th, will mark the 5th annual National African American Hepatitis C Day, or NAAHCAK for the acronym. This day provides an opportunity to promote hepatitis C prevention, testing, and treatment messages to public health partners and the Black community. African American Action Day also provides a chance to discuss the importance of linkage to care and integrating prevention opportunities, as many people at risk for acquiring hepatitis are often at risk for acquiring other infectious diseases such as HIV. So African American National Day was co-founded by NBLCA and the Coalition on Positive Health Environment, also known as COPE. And so I'm pleased here today to discuss all of what we will be doing and some past activities. We have Gloria Searson, who is the founder of COPE and an internationally recognized advocate, leader, and educator in the fields of HIV/AIDS and hepatitis C. Ms. Searson has over 20 years of experience working in chronic disease management, substance abuse, counseling, and advocacy. In 2010, when Ms. Searson founded COPE to raise awareness about viral hepatitis, especially among baby boomers and African Americans, as well as to provide health education to providers and patients about HIV and hepatitis C, co-infections, and the effects of substance use on these diseases, very little attention was being given to this important issue. So Gloria, thank you so much for joining us, and thank you so much for what you do to create more awareness. I know it's not easy, but getting things done has never been easy, and I know your track record, and I know that never stops you. So welcome, Gloria, and we're just going to have a conversation. And before we talk more about hepatitis C, why don't you just tell our audience a little about COPE, why it led to you founding COPE, and sort of what has been your experience in that arena.
So, back in April of 2010, I was actually looking for employment. I was working at North General Hospital, and as you know, that was one of the leading providers of healthcare, had 800 patients who are HIV positive, and they were left with no place to go get their healthcare. And that left me in a position to say, how would I do things differently? And I started thinking about what would be one of the impacts I can make on this community. And I thought, well, hepatitis, we're at least making so much progress with the medication that maybe that would be an avenue. And I started to do a little bit of research, and I noticed that no one was talking about it. No one was preparing for what was about to come, some land-breaking medications that were offering people who otherwise didn't have treatment an opportunity to get cured and to fix a real problem that was plaguing their quality of life.
And so, of course, we've seen a lot of progress with respect to hepatitis C, because at least now there is a cure, but we're still not seeing enough people get tested. Is it, you think, some having to do with the fear of the old treatment, which I've heard a lot about in terms of the impact on a person's body, and people are just afraid?
I would like to really think that it was that simple. I think that there's some underlying bias here. When you start to look at who the population is that really has Hep C, it is not just baby boomers, but potentially baby boomers who had exposure to the HCV virus sometimes 20, 30 years ago, potentially not living like that today. It was healthcare workers, veterans, people who had a history of being incarcerated. All of these individuals I knew were exposed. They were not in the HIV community, so there was probably little being offered to them as far as information. I knew that in the HIV community and the substance use community, we've at least knew that hepatitis existed. Whether we were proactive or not was another story, but we knew that it was in our population. What I wanted to do initially was bring it to the awareness of all of what we call the mono-infected population. People like myself who were now in our 50s, who may have been exposed the way we lived 20, 30 years ago. Often we forget how and what we did in our young years when we were invincible. But those things exposed us. I mean, there were no universal precautions, yet this virus was out there. We used to call it pre-1992 non-A, non-B. So there was a good opportunity to have some awareness, but no one did it. So I was doing it back then in all of my positions that I've held because I understood that this was a silent killer. This was something that was plaguing a specific population within the HIV community that was already marginalized, that was already estranged from really good health care. And then the old treatment, which you've mentioned, most of us remember and recall the horror it was to deal with. And it didn't really offer us any benefit. When I say us, I mean primarily African Americans, people who were co-infected. The previous treatment had something like 7 to 29% efficacy rate, not even the word cure, but efficacy rates among the same populations that are getting 96 to 100% cure rates today.
That is amazing because many of the conversations I've been in, people, again, who took the earlier medication speak about, oh my, what a relief it is.
Oh.
And they really tell a great story. The narrative has changed significantly. You mentioned something about the population, and I think probably what most of the viewers will often see, including the ads on television about hepatitis C, and they identify the baby boomers, but they still don't break it down in terms of the broader population that you just talked about. So talk about this broader population, including intravenous drug users with the opiate use now and the tattoos.
It's so interesting. You know, when I started working in hepatitis, it was 1998.
Okay.
And at that time, we were only really targeting HIV community because that's where we saw that there was 30 to 60% of the folks living with HIV had also had hepatitis C. But what was the data showed was that it was really more or less concentrated on the IV drug use population. So we started to look at that and go into harm reduction programs and methadone clinics and provide education. But it was really hard back then to talk about treatment because even though there was treatment, it wasn't a very good experience. It was going to be challenging for a group that was already suffering and dealing with multiple issues. Secondly, you had to use an injectable product back then to treat hepatitis C. So if a person was in recovery or trying to stay away from drugs, the treatment itself back then was a barrier.
The process.
Yes. I mean, could you imagine having to use the very thing that you wanted to stay away from to take care of it and get the same illnesses that you tried to use to avoid? I mean, it was depression and pain, just physical pain and flu-like symptoms. So no one was going to feel good about themselves. The duration was anywhere from 12 to 18 months, especially compared to 8 weeks potentially, 12 if you have cirrhosis. Imagine that. Cirrhosis was the scariest thing for anyone with liver disease. And these new medications, they're almost like, come on, even with your cirrhosis, people are getting off the transplant list with these new medications. So if you've been in this as long as I have and you saw the data and you saw these drugs and what they were about to do, I mean, I couldn't even sit still in 2010. I was just thinking, you know what I could do? I can go back to all those places that for the last 15 years I had nothing to offer them. That would be the beginning of COPE, to just build partnerships with people who had patients sitting there for the last 10, 15, 20 years with no offered solutions. And my goal initially with COPE was to work with these organizations and hospitals and bring in our expertise of being behavior modification specialists, people who understood hepatitis C from its very core, how it how it affects people, who it affects, where it comes from, and understanding the social determinants that led them there. But not only that, we're the experts on the science, right? COPE is built with a coalition of providers who've been doing this work, who waited for this day. I mean, we couldn't believe that when December 2013 came, and we actually had an all-oral regimen to treat people with, that this country was not ready to help us get them people
Thank
treated.
God COPE was.
I was ready, but with no funding. I did it on a small scale. We did it. I mean, when I say COPE, it's a partnership.
Right.
And I think that there's something to be said about how HIV and advocacy has led the way, and how that opened up the way for us to get it right with Hep C.
So let's talk a little bit about fast forward to now in terms of what you've been through and seeing the lack of awareness, attention, the very harsh medication. Where are we today in terms of funding, understanding, and also talk a little about viral hepatitis A and B, because that often comes up, and of course we know C seems to affect African Americans more than A and B. So just briefly mention A and B, and
well, I want to
let's see where we are
A and
today.
B, probably for African Americans, we could shortcut and not even be scientific and say probably because they've been vaccinated. For B, hopefully, because they're born in America, and if you've been in an institution or you've been in school, you've had to be vaccinated. B was not since birth like other vaccinations. We learned, I believe it was in the 80s, that most Americans will be exposed to hepatitis B, and then we started vaccinating people. And actually, it's one of the best vaccinations ever developed, hepatitis B, and it's 3 shots over 6 months period. And everybody, if you haven't had a hepatitis panel, not just hepatitis C diagnostic testing, but a hep panel, because there's more than one type of hepatitis. A and B, they affect the liver. A is more like food poisoning. You probably were exposed, never knew, just felt sick for a few days, turned a little yellow, got better, and then never knew. B, has some of the same risk factors as HIV. It's sex and using needles and stuff. And it plagues the Asian community a little bit more than it does other communities. But it doesn't mean it doesn't exist in our community. And often you'll find some of our individuals, they have both. They have HIV, Hep B, and Hep C. They travel together. They are viruses that operate in the same communities. And that's one of the reasons I really thought we'd have a huge opportunity, especially in the HIV community, to screen and treat almost anyone who was in care and have all of them cured. And I think that most people have done a good job with their HIV community if they're in care. So that's where we've done a good job. Funding has been scarce. Even though we've had a lot of support under the previous administration, we were able to get the awareness day and open up a lot of avenues and bring hepatitis C even into the White House. Funding didn't follow that necessarily. I think the Affordable Care Act did help states expand just their ability to help patients, right? And that opened up the door for screening. The challenge was, after people got an antibody test, there were no infrastructural systems in place to help them do the next step. And it's very unfortunate, but without resources, people very rarely just go ahead and do. Unfortunately, that's what an organization like COPE would have no choice but to do. If we found a positive, we would automatically not assume that they're positive until we got a confirmatory test. Other organizations might not have been armed with what they needed to do everything that it took to actually confirm if that person was actually still positive. The difference with Hep C is that people clear it on their own and they didn't know. So you will always test with an antibody positive, even if you've gotten cured. So often we go and we do these rapid testing in communities and we wind up retesting the same people, but we never actually got a confirmation. And if you look at the cascade of Hep C, it is really dismal. it is less than 50% of the people who are estimated to have Hep C have actually had a confirmatory test.
Less than 50?
Less than 50%. And what that says to me is that even hospitals and places where people are that are known hepatitis positive or at risk, they're not drawing the blood. They're not doing the blood test. And I'm not sure if they're saying they're not adequately resourced for a blood test, but it seems to me if these are already your clients, and you're already taking care of their substance abuse problem or their other medical problems, that you could tack on this other test and get them confirmed.
So how are we supposed to look at the numbers then that come out in terms of the number of people who are living with and or been cured from Hep C? And I raised that because just recently, members of my national board of directors convened their annual meeting in Atlanta. And being in Atlanta, we met with leaders, representatives from CDC, from the HIV, AIDS, infectious side, as well as hepatitis C, Dr. Ward, whom you know very well. And it was of interest because CDC had just recently released a report, and it showed the number of the rates, incidence, as well as prevalence across the country, state by state. And when we looked at the profile of the 11 states wherein BLCA have affiliates, and we looked at states where we have partners like South Carolina, Alabama, Mississippi, and the rates of hepatitis C, very high. But when you looked at the amount of money, which they also showed, the dollars that CDC is putting in these southern states, where not only do we have higher disproportionate rates of HIV and AIDS, but also hepatitis C, it is dismal. In one state, I think like South Carolina, where the numbers are through the roof, they give something like $52,000 or $90,000 for Hep C. How is that going to do anything? And then, of course, the discussion also led to something else you said. Even after people are tested, there's a lack in infrastructure in terms of providers to cure or providers to even test. So I'm concerned about, number one, testing, then not having the backup to cure people or to refer them to even be cured, and then the lack of resources going into these cities and states where we see high rates.
I mean, it's the reason why there's no uptake in treating, because I think the advocacy is not coming from the right channels. I'm not sure if you remember when and why I came to you to partner for African American Day of Action.
Remind me.
I needed us to make a larger splash, to break through just the HIV conversation and the substance abuse conversation, and have a conversation in our community around, if there is something that is asymptomatic, killing us, how are we going to handle it? Because no one's gonna run and do something for us that isn't preventing us from getting up and going to work every day. And that's what this virus is. It's something that people are existing and living with. Their quality of life has been reduced, but that's a case-by-case basis. So there's no one that's gonna say, oh, they can't see the workforce being reduced yet. They're gonna see it in our community if we don't get some individuals cured. This has been a disease that people have been walking around with for 30 years. So often no one's gonna see the urgency if the person themselves living with it doesn't understand the urgency. And who gave them the information? You know, Ms. Fields, we did a survey back in 2013, and we purposely went to every kind of geographical area. You know, we were in Norwalk, Connecticut, so at the Oyster Fest, so we can get some affluent people from some different zip codes other than just South Bronx and Harlem. We were in Park Slope, we were in Far Rockaway. We went at least to 68 zip codes. We talked to 683 people who had Hep C. 95% of them had a doctor. 95% of them knew that they had Hep C. 95% of them had insurance. Only 5% of them knew what hepatitis C was. So where we are at fault.
But 95%
were linked to what they called, they had a doctor who knew that they had Hep C.
Gotcha.
Now what what kind of care that looked like wasn't discussed at that survey.
Right, sure.
But for them to say, I have a doctor, that meant they felt that this was their doctor and that this was the person that was taking care of their Hep C, and that they already knew, and that they didn't really need anything from me because that was happening. So as I began to say, great, then you've heard about these new oral medications that are curing people in 8 weeks. Not one of them had heard it. 9 out of 6.
So they, in fact, had not been cured, but they knew they were living with Hep C.
Right. So what that means is no one proactively called them and said, oh my God, you know what, there's some cures coming out. I haven't been able to do anything for you for 20 years. So there's levels of bias here. There's like, it's not broken. She's been okay. I'm not bothering her. And also, I don't think people who don't work in this field every day, who hasn't watched the data the way someone like me has, really believes in this.
So how do we break through all of this?
We do it with education. And we do it even when people are kicking and screaming. We do it everywhere and in every street corner. You know, I remember when you brought HIV education to the faith community. Why? Because you understood the role that churches played in a community. And you knew that if they bought in to this message, then it wouldn't be such a guilty thing to live with in a place where you're supposed to get some kind of comfort.
Right, that stigma perhaps could be broken through. But going back to something you said earlier in terms of reaching the broader community, I think with Hep C, when we look at other civic community organizations, your sororities, your fraternities, all of these groups who perhaps were engaged in certain activities back in the 80s, early 90s and so forth, and didn't think anything about it, like you said. But
this is their time.
This is their time, and I find that when we've gone on some of the serious radio stations where that population listens, the interest has been very high.
And they can embrace Hep C, and I feel like in our community, the education around exposure is important, because if you think about how most of us receive dental care, there's our plausible deniability if you need one. Right? Most of us have been exposed to potentially Hep C just going to the dentist back in the days pre the way they do dental hygiene now. I mean, universal precautions were not in effect until 1992. So everywhere that you were exposed to anything that had blood on it, you potentially came into contact with hepatitis C.
Is that part of your delivery when you meet with the community?
Absolutely.
Yeah.
I'm like, where did you get that tattoo? How do you know? Did you look it up? Did you even know that it lived in the blood? Because often we do the shortcut. Oh, I know him because he was on TV, so I know that tattoo parlor is good. And I go, well, do you know what a practicing policy is for a tattoo parlor? And if you don't, should you go in? Have you ever been into a nail salon in our community? We should be boycotting them for our people if they haven't been able to understand why they should boycott them themselves. If something gets blood on it, it's potentially an exposure opportunity for somebody.
So how would you not, see, this is really interesting, especially when we think about the nail salons and places and hair salon in our communities. How would we advise or inform people what to look for when they go to, say, a nail salon?
Well, I mean, it's hard. I mean, it's hard.
You don't want to scare people, but you want to educate and inform.
Well, I think first of all, they need to read it themselves, right? Like everybody. If you can't read, we even have these great DVDs getting to the basics on Hep C. Mark Sikowski did a great job. So that you can find this information, how to be exposed. The other thing is, back in when I first started doing this education, they would not even say that this was a sexually transmitted disease. And it wasn't until we started to see people who were potentially really not IV drug users getting diagnosed with Hep C. And then they said, well, maybe. So again, we're not educating our community around anything that we need to as far as exposure. So I just want to say, people living with Hep C were told, you're going to be okay. A lot of these women could potentially be pregnant today or getting ready to have birth, and now we have new data about mother-to-child transmission. So if they're doctors from the old days and he hasn't been cutting edge, that's a scary situation for our folks to be in as well. A lot of our folks are dealing with hepatitis C and cirrhosis. They're using the emergency room as their primary care. They're going to get their stomach reduced and have it drainage and stuff like that. And they're thinking that's a quality of life. There's treatment now. There's all these things that have given us advancement. We don't have to accept that our people are dying. Hepatitis C scares me way more than HIV.
Why is that?
Because in HIV, we've put a system in place that actually works with people through this journey. You know, even if they're in and out, they can find it. Whatever city, whatever country you go to, you could go to a hotline or a website and find an HIV resource.
But not with Hep C.
With Hep C, I think we're trying to do that now. We're doing a lot of storytelling, a lot of media around social media, you know, storytelling.
And a good thing, of course, now, as you know, New York State at least has now started looking at Hep C and HIV because of much of what you've said. With the minute or so, Gloria, that we have, because you're so full of information, we obviously go on, but just talk very briefly about, you touched up on some of the new trends that we are seeing with respect to diagnoses as far as mother-child and...
Well, you know, everybody wants you to talk about the young people, right? You know, most of us were young too.
Some point.
30 years old. Most people got Hep C when they were 25 too, and 30. But today it seems like it's a new epidemic. No, it's just that we're not talking to the people when they were new. They're baby boomers now. We didn't have anything to tell them when they were 25 and we knew they got this. So now that it looks like a different community. It looks like the communities that weren't necessarily plagued by these things before. There's a huge rush to go and save the young people from getting Hep C. And I'm not against that. I'm just saying there's some people that may die who are 50, 60, 70 years old, who need some attention. The new epidemic, we're doing a good job with harm reduction, but we need to just go and do more in other places around substance abuse, around depression, around all the things that lead people to use.
Certainly that whole mental health
Exactly.
area. Well, Gloria, we're definitely going to have you come back, and hopefully this has been an eye-opening. We hope that people who have watched this will certainly participate in the city on July 25th for Action Day. So again, thank you, Gloria Searson, for joining us today. And to find out more about COPE, visit copehealth.org. That's copehealth.org. And learn more about NBLCA at our website, nblca.org. Also look for NBLCA on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings you these programs to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, friends, and neighbors know about this program. Again, I'm C. Virginia Fields, and I thank you for joining us, and hope you'll tune in next time for NBLCA's Health Action TV, right here on Manhattan Neighborhood Network.